Aloha, guys. Dr. Thomas back with you again. This time we're going to talk about Chapter 2 and Midterm 1. I'm trying to get this adjusted properly. Okay, all right. Well, we're just going to go with it, all right? Okay, language of medicine. Yeah. Chapter 2, terms pertaining to the body as a whole. Guys, this is not a long PowerPoint, but it's an important one. I'm not going over the goals, of course. I modified this PowerPoint myself, but maybe I shouldn't say that. If it turns out junky, then you'll know who to blame. And it's someone else worked on it some too. Okay, structural organization of the body. The most basic part, we have cells. Bone cells, blood cells, etc. Cells come together, different kinds of cells, to form specialized structures called tissues. And I don't mean the kind of tissue you blow your nose on. And then tissues come together to form organs like the stomach, the brain, etc. Organs come together in a highly specialized fashion to form systems of the body, like the digestive system, the nervous system, etc. Okay, so this is the hierarchy of it. Cells, tissues, organs, system. I'm drinking a diet soda, yeah, so my voice won't give out, and I'm burping. Yeah, I'm disgusted. With myself, not with you. All right, structural organization of the body. This is going to be covered a lot more in anatomy and physiology, but here's a basic animal cell or human cell. Major parts of the cell include chromosomes that contain the genetic material. They're inside the nucleus, the control center. And then the nucleus is the next one. There's a very complex cell membrane, guys, that surrounds the cell that controls what gets in and out of the cell. The gel-like material liquid inside is called cytoplasm. It gives shape to the cell, and it acts as a ground substance for stuff to be transported around. The little structures that look like kidney beans that produce energy in the cell are called mitochondria. Mitochondrion is singular. There is an extension of like conveyor belts through the cell, which are called endoplasmic reticulum. If they've got little dots on them called ribosomes, it's rough endoplasmic reticulum. And if they don't, it's smooth endoplasmic reticulum. Okay? There's also some more. You'll be going over this in anatomy and physiology in much, much greater detail. This is just to give you a little introduction. Okay, functions discussed in anatomy and physiology. Anabolism is to build something up. Catabolism is to break it down. Cell membrane is the extensive skin or covering of the cell, again, that I said a moment ago, regulates what gets in and out. Chromosomes contain the genetic material and are in the nucleus. Cytoplasm we mentioned. DNA is the molecule that contains the genetic code in living things. Endoplasmic reticulum, we mentioned, packs and ships out proteins. Genes, genetic material that leads to a trait like eye color, hair color, height, etc., contained within the chromosomes. Metabolism is the chemical processes in the cells and in the body. Anabolism is building up as a metabolic process that builds up. Catabolism is the metabolic process that breaks down. Mitochondria, power plant of the cell. Nucleus, the brains of the cell, or if it were like a factory, it would be the headquarters, the front office. Structural organization of the body, we talked about different kinds of cells. There's lots of different kinds, but here's some examples. Here's a stylized nerve cell. Here's a muscle cell. Here's a fat cell. Notice that most of it's liquid fat. Fat is necessary, but of course a lot of us are carrying around a little too much. But now, you probably don't know what an epithelial cell is, but epithelium is specialized tissue found all throughout the body. Okay, so cells make up tissues. Similar cells together form tissues. For example, muscle tissue, connective tissue, nerve tissue. And then the various tissues come together to form organs. Different types of tissues join together and form organs like the stomach, the small intestine, the brain, the lungs. And in systems, groups of organs working together form systems. For example, the digestive system. Okay, you're going to go over all this in an A&P also. So, you're getting a double exposure to it, guys, which is a good idea, which is what Dr. Wyatt had planned to start with. That's why he's changed it, which is a great idea, I think. Study section 2. Epithelial cells form a lining or a covering. Cytologist is one who specializes in studying cells. Adipose tissue is the medical term for fat. Now, fat is absolutely necessary in the body, guys. It helps cushion organs and provide energy. But as you know, we currently have a problem with too many people being too fat in the United States. Cartilage, type of tissue that serves as a cushion. Our nose is cartilage. Our ears are cartilage. That's why they're flexible. Part of our ribs are. There's cartilages in our knee and all throughout the body. Viscera is the covering around organs. There's specialized membranes and stuff, guys, that wrap around it. Now, if you saw this in medical terminology and you said histologist, it's someone who specializes in history. And that would be a good guess, but it would also be an incorrect guess. In biology, histology is microscopic anatomy. It is a specialist who studies tissues, cells, and I always learned it, histology as being microscopic anatomy. So we have gross anatomy where we learn the biceps muscle and the eyes, and then we have many subdivisions of that, and one of them is histology. Okay, now there are a number of cavities in the body. Okay, cavities are hollow spaces which hold organs. The cranial cavity up on the head holds our brain. Our brain is completely surrounded by a bony cavity. The thoracic cavity is in the midsection. It contains the lungs, heart, esophagus. That's the tube we swallow food through. The trachea, tube we breathe through. Bronchial tubes, thymus gland, aorta. A lot of these you may not know what they are, but you will here in a couple of weeks. There's also so the thoracic is like the chest cavity. The abdominal cavity is the stomach cavity. It contains the actual organ of the stomach, the intestines, the spleen, pancreas, the liver, which you've heard of, and probably heard of the gallbladder. You may not have heard of the spleen. That's okay. We're going to learn all that very soon. There's also a spinal cavity. It's a long, narrow one, and it contains, going down the back, and it contains the delicate spinal cord. You're all familiar with that, I know. Okay, here's some drawings of them. So here's the cranial cavity. Here's the vertebral canal or cavity that holds the spinal cord. Here's the thoracic cavity. Here's the abdominal cavity and the pelvic cavity. And combined, these are typically called the abdominal pelvic cavity. Here's the diaphragm. It's a huge muscle that runs transversely in the body and controls breathing. It's really important. The diaphragm separates the thoracic cavity from the abdominal pelvic cavity. Dorsal is a word for back. Sometimes it's called posterior. Ventral is a word for front. And lateral is a word for on the side. Or a view. This is, for example, a lateral view. We're looking at it from sides. Here's the nose, and so the person is facing this way. Okay, organs of the abdominal, pelvic, and thoracic cavities. I guess this is hard to see. This is just something, I left this in here when I was doing this, because it'll give you an initial introduction to some of these organs. Very quickly, here's the trachea we breathe through, thyroid gland, here are the lungs, heart's back here. Here's the liver, the stomach, the spleen, pancreas is hidden behind the stomach. Here is the small intestine, and here's the large intestine, also known as the colon. See, it wasn't too bad. The chest cavity is lined with a membrane called pleural membrane, and so it's also called the pleural cavity. There is an anatomical boundary called the mediastinum. This important word. It's the front middle part of the chest. It's where the heart and the great vessels and other structures are located. So the mediastinum is not an organ. If you cut somebody open, you wouldn't find one. It's a boundary that's classified as containing these structures. And it's in this area here behind the two lungs, and containing the heart and all. Mediastinum. Okay, now, There are two ways to label the outside of the abdominal pelvic area. The easy one is the quadrants. You make a cross at the person's belly button. This actually looks slightly high. I'd say it'd be more like here. And it's a right upper quadrant, left upper quadrant, right lower quadrant, left lower quadrant. How would you use these? Well, let's say somebody comes in and they have nausea and diarrhea and they have pain in the right lower quadrant. And when you press on it and let it go boing, it hurts. They probably have appendicitis. And that's located in the right lower quadrant. Here is the appendix. So, for example, if the doctor would say a patient came in reporting of rebound tenderness and inflammation in the right lower quadrant. Now, there's also another way of doing it. These are just optional ways. There's what's called the region, and there are 9 regions. Epigastric, remember that means above the stomach. Umbilical region, around the belly, the umbilical area is the belly button. Hypogastric means below the stomach. Then we have a right and left hypochondriac region, a right and left lumbar. Lumbar means low back. And a right and left iliac region. The iliac's in and around the groin area. Now, you just have to memorize that, guys. But this is used to describe, let's say somebody was in a car wreck and they sustained a bad bruise in the left hypochondriac, and right here. The doctor can say the patient has a bruise in the left hypochondriac region. Now, I know what you're thinking. You're thinking, Dr. Tom, why are you over here calling this the left when it's the right? Because it's always the patient's left and not our left. It's the patient's left and the patient's right, not our left and our right. Anatomical divisions of the back. Well, there's the neck, which is called the cervical spine. There's the mid-back, which is called the thoracic spine, the ribs attached to it. There's the lower back, which is called the lumbar spine. There's a bone at the base of the spine called the sacrum. Looks like an inverted triangle. And at the very end, there's a little tiny bone, a tailbone called the coccyx. But the region is the coccygeal region or the sacral region. Okay, here's a lateral view of the spine. The patient will be facing this way. There are 7 cervical vertebrae. They're numbered C1 through C7. Although the first one and the second one also have a name. C1 is also known as the atlas, C2 the axis. There are 12 thoracic vertebrae, numbered just T1. Now this has got TH. No. I'm a chiropractic doctor, believe me. If anybody knows this, it's me. No, hell no, I've never seen that. It's T1, T5, T7, I just noticed that for the first time. But I'm the one that got this picture from the internet, so I'm to blame. I'm sorry. Okay. The low back, there are normally 5 lumbar vertebrae. Here's the sacrum. And here's the little tailbone, the coccyx. And this, guys, is the human spine. You stack these on top of each other, it forms a canal down through here that the spinal cord runs down through. And everywhere you see these holes are nerves coming out. There are 31 pair of spinal nerves. Vertebra, 1 backbone. Vertebrae are backbones. This is singular, this is plural. Spinal column, spine. Spinal cord is an organ. Nerves protected by the vertebra. Between each of the vertebrae, except for one exception, there are cartilaginous discs here. Fibrocartilage called the intervertebral discs. They act like a cushion. There's not a disc between C1 and the skull, but the rest of them have it. What's our time looking like? We've got less than a minute. Okay, these are real important, guys. Positions, directions, and planes of the body. Anterior and posterior. Anterior means front, posterior means back. Deep and superficial. Deep is deep and superficial is more on the surface. Proximal and distal. This is something we'll have to go into. It'll take a little bit to explain that. Superior and inferior. Superior means above something. Inferior means below something. Medial and lateral. Medial means towards the midline. Lateral means away from the midline. Medial means towards the midline. Lateral means away from the midline. Do you need to know these? Absolutely. You need to know every freaking one of them. Supine is lying face up. Prone is lying face down on your stomach. Okay, Dr. Tom signing off. We'll continue in a moment. But